Hypertension is the silent killer. It's one of the most common presentation to the cardiology clinics and to emergency departments. It's very common. We experience lots of patients with high blood pressure, but the most important is to properly diagnose blood pressure. We need proper training to train our staff, to train our nurses, to train ourselves to accurately measure blood pressure and don't rely on just one reading. And sometimes we also put for the patients devices called 24-hour blood pressure monitors, which are devices that we connect in the clinics, and it will measure the blood pressure at home, and we study it later and we decide if those patients fit the criteria for the diagnosis of blood pressure. Whenever we have a patient with high blood pressure, we have to exclude secondary causes, because in like 5 to 10% of the cases we have secondary causes of hypertension which are curable. Once we diagnose those, we can correct those factors or causes and lead to resolution of blood pressure. However, many times, more than 90 to 95% of the cases, hypertension is essential. We don't have a reason why the patient have hypertension. The take-home message is that whenever we suspect high blood pressure, we have to seriously follow the patient, properly diagnose the patient if they have high blood pressure or not, and then educate the patients to change their lifestyle, acquire a good diet, stop smoking, and follow a low sodium diet and a low animal fat diet in order to make sure that those patients require medical treatment or not. Many patients can correct their blood pressure without medical treatment. However, if the blood pressure is too high, above 180 or 110 millimeters of mercury, it's very difficult to control them without medications. However, this is the decision of the physician to decide if those patients will need blood pressure medication or not. So the cornerstone of this is proper diagnosis, then follow the guidelines and treat your patient. Thank you.